evening from wherever you're watching me. Welcome to my YouTube channel. In case you're meeting me for the first time, my name is Midwife Adorable, your #1 healthcare provider that brings health solutions and health services to the comfort of where you are. Today I'll be giving you a health education concerning a pregnant condition. And this pregnancy condition is one that anytime you've been diagnosed with, your pregnancy is then considered to be a high-risk pregnancy. So if you're a young lady, you're about to get pregnant, or you're already pregnant, or you already have this condition, come close. This video is for you. PIH, pregnancy-induced hypertension. A lot of you will be wondering, what's this? Okay, I'll define it. Pregnancy-induced hypertension is a situation whereby a pregnant woman who was not hypertensive before or who has never had a high blood pressure begins to have a high blood pressure above 140/90 millimeters mercury after 20 weeks of gestation, that is after her 5th month of pregnancy. And this definition is by the National Center of Biotechnology Information. So what are the causes? Number 1, genetics. Genetics in the sense that African American women and the Asians are prone to hypertension generally. So if you're of the black race, there's a possibility that you will come up with hypertension in your present pregnancy. Another one is obesity. This one is a very, very essential cause. I know this is the time you want to eat everything. You're hungry for shawarma, you're hungry for burger, for pizza, you want to fry eggs and eat and enjoy. I am not saying you shouldn't eat, okay? But be careful of how you eat, what you eat, and when you eat them. Because once you become too obese in your pregnancy, you're already predisposing yourself to having PIH, and I did not send you. Another cause is your first pregnancy. Pregnancy comes with a lot of complications, comes with a lot of body changes and all of this. So there are some people who generally pregnancy just keeps them off balance. And your first pregnancy is the fact that Newton is being introduced to your body, right? So your body is trying to get accustomed to it and all. So that process of trying to get accustomed to it, your fetus growing, and it can just lead you to having high blood pressure because your body is not yet understood itself as per what is happening to it at that moment. Then we're going to talk about assisted pregnancy. If you've done surrogacy motherhood or IVF, you're prone to having pregnancy-induced hypertension. Like I said, it is not a constant, but most times, if you have an assisted pregnancy, you will come up with this health condition. So stay with me to the end to know how you can prevent it and what you should do about it. Then we're going to talk about this one. This one is increased salt intake. This is when you want to eat fish. I know some women that want to eat fish Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. Every day of the week they want to eat fish. Please don't get me wrong. I'm not saying you should not eat like I said earlier, but be careful of salt intake because the more you take in salt, the more you're prone to having PIH. Now, know that this salt is called the sodium chloride, and sodium is an element that has the ability to retain water. So if you keep taking salt or keep eating food that has a lot of salt, sodium will go and help you retain water, leading us to a sign and symptom which I'm going to talk about. The last but not the least, about abnormal placentation. If you have placenta previa, placenta sensitoria, or any kind of abnormal placenta, there's a possibility you will come up with PIH in your pregnancy. So you may ask how it can come up, because the placenta is the only passage or the only means where the baby gets nutrients from the mother. And imagine you have issues with the placenta, it means you will come up with diverse health conditions, and pregnancy-induced hypertension or PREECLAMPSIA is one of it. Then we are going to talk about now the signs and symptoms. What are the things you will feel, or what are the things your healthcare provider will see in you that will make him or her diagnose you to have PIH or preeclampsia? Number one is edema. And edema comes as a result of, okay, I'm going to talk about that much later. I'm going to broadly explain edema. Another sign and symptom is nausea and vomiting. Normally, nausea and vomiting should come in your first trimester, which is the first, second, and third month. But once it's extending into your fourth, fifth month, it's a sign that you must have come up with pregnancy-induced hypertension. Another one is constant headache. It might not be pounding, it might not be the migraine, but there is this trace of headache in your head that you're not just getting over it. Even when you take some painkillers, it's not just going. Watch out, you could be having PIH. Another is blurred vision. Blurred vision in the sense that you're seeing, right? Everything, not like you're blind, but it's just blurred. You're not really getting it. It's just, you're just feeling, you're looking like this. Blurred vision is a sign and symptom of PIH. Then we're going to be talking about already established high blood pressure we talked about earlier, that is above 140/90 millimeters of mercury. Then we're going to be talking about abdominal pain. You're constantly having abdominal pain around your stomach, not necessarily down, where we call the lower abdomen, right? Just round the upper abdomen, the lower abdomen is just giving you pains. Watch out, you could be having hypertension in pregnancy. Then we're going to be talking about oligonuria. This is a medical term to describe reduced urination or scanty urination. Normally, pregnancy comes with frequent urination, but this time around, the quantity of urine you pass out is small, and the time interval is longer. Like the time between the first passage of urine for the first day and then the second passage is usually longer. Normally it shouldn't take up to 1 hour to 30 minutes for you to feel pressed again for a pregnant woman, but this time around it's not just coming frequently and it's coming in reduced quantity. Then the last two signs and symptoms is the protein in your urine. This can only be noted or checked medically. We have a laboratory investigation called urinalysis, and can only be done in the hospital. So if you're not going for your antenatal and then you have come up with preeclampsia, there's a possibility that you won't know, because it's a constant going for your antenatal, they do your urinalysis, that they can be able to detect if you have protein in your urine or not. Lastly, we'll talk about shortness of breath. At 5th month, your stomach should already be big, as in the baby should already be, cause abdomen to become big. But when you're constantly having shortness of breath, I'm saying this to say that normally when your stomach is big in pregnancy, there are times when you're not going to be breathing fine, but when it's a constant that morning, afternoon, and night, throughout the week, throughout the month, you're just trying to breathe, your breath is short, you're not able to do anything, you're just all trying to grasp air. It is a very bad sign. Please go to the hospital for better check. Now, I said earlier that we'll be talking about edema. So thank you for watching till the end. Please, if you watched to the end, comment on the comment section. If that's adorable, I watched to the end. Thank you so much for watching. We've come to the end of today's class. Stay tuned for more. We'll be coming up with lots and more health education that will help you as a female, as a male, to grow in a reproductive health life with ease, without pain. See you.